Good day. Thank you all so much for joining us. I'm hoping to share with you today some valuable information regarding the work of the Global Health Workforce Council. The Global Health Workforce Council came as a result of an award received by Hema through the U.S. Department of Commerce around strengthening the health information global workforce, recommendations for standardizing competencies and curricula requirements. I've included a link that will take us to the Hema website. And here is where you'll find much of the information that we'll be discussing in the presentation today. You'll find on the right side of the screen what those work groups are related to. And in fact, we're now going to be headed into the work groups forming for phase 3 and how you would join those work groups. And we'd encourage you, if you're interested in the subject matter, to join us. All good minds are very welcome, and we appreciate it. So first and foremost, we need to talk about the importance of health information. And when we talk about health information, we talk about it because of its role in how it can improve patient care. And more broadly, not only the care of a single patient, but that across the population as a whole. We know that with advancing health information exchange, with medical tourism that's seen on the rise in many of the countries throughout the globe today, and the fact that patient expectations around how their health information is managed is critically important. So those three foundational concepts lead us then to also look at this from the broader perspective of population health. But I think the other important thing that I want to mention before I go into great detail about the population health impact is, why is this an issue at all? Why is there a need to look at how to manage health information in addition to the technological aspects? Well, certainly one of those, and the reason that the Department of Commerce was so supportive of this grant opportunity, was because we know that there's been great advancement made in technology. And as that technology has been exported to various countries across the globe, what we've also noted is that the workforce in every country is not equally prepared. So establishing a set of foundational academic competencies is a way to prepare a country for the adoption of an infrastructure related to the appropriate management of health information. So now let's keep that in mind as we look at how this can impact population health. So the first items that you see on the screen here is representing the fact that population health can be positively influenced through research and evidence-based clinical practices, and most importantly, through the development of a unified health data set. We currently, in many countries, are collecting data electronically, and in some countries in paper, and in some countries maybe not so much at all. But the importance is having a unified way to exchange that data and to ensure that what we're exchanging is interpreted in the same way in every country. This speaks very much to the concept of standards. And so in addition to much of the work that's being done with the GHWC, we know that there are countless organizations, Hema among them, that's also been very actively involved in looking at data standards that can help to lead to a unified health data set. At the very root, the concept of having coded records that are timely and accurate, making sure that diagnoses and procedure codes are classified in a way that can be meaningfully shared across countries, also ensuring that the documentation of the records supports that coding timeliness and accuracy, and certainly the health information workforce as a whole. So the other important part of this discussion is I've already talked quite a bit about how this project is looking at the academic competencies, but equally important is how those academic competencies are intricately linked to what workforce needs. And you'll hear a lot more about that as we go throughout the rest of the slide presentation. So some of the supporting concepts that were used in the grant proposal is the fact that there is global expansion of e-health technologies. and that we know that human resources are the most critical prerequisite for the implementation of these technologies. You can have all the technology on Earth, but if people don't know how to use it or what it means, it isn't going to provide us with the outcomes we want. Healthcare systems need well-trained and highly skilled workers, and there's a comprehensive healthcare education and workforce strategy that we're in need of. So the work of the Global Health Workforce Council is important in helping to establish what those strategies are. We know that with increasing technology, complexity of the information is the result. And so we know that, health information has been around for many years and it's been complex in a paper world. So now when you add the multiple facets of multiple systems creating many types of new data that can provide great advantage, we have to have a set of strategies that will help us to understand how to use those. Also from the grant proposal, we knew that this effort through the GHWC would help to advocate for a global HIM workforce. So as the competencies have been created, there of course is then a corresponding effort to ensure that the workforce recognizes, if not today, certainly that they're prepared for the future of what health information can do to benefit their population health, as well as patient care directly, and even to support organizational operations. Preparing the HIM workforce and the healthcare delivery systems to effectively manage data, establishing global competencies in HIM, informatics, and HICT. And so just to spell out what these are, because they are core and central to everything we do, the concept of health information management, informatics, and health information and communications technology, HICT, are the three professional disciplines that are represented by the global curriculum, by the Global Council's curriculum for the health information professions. And we refer to these three disciplines, HIM, informatics, and health information and communications technology, as the health information professions. We need a way to contribute to safe, quality care through enabling trust in health data and information. We need to promote standard practices in all areas of HIM. We need to enable professional certification in critical data and information-centric healthcare system roles. And we need to be able to enable reliability and integrity of information across the respective healthcare ecosystems. I will comment that in previous presentations, we've had several questions related to certification. And I will tell you at this point that ideally through the use of the Global Health Workforce Council's global curriculum, that there are efforts underway to establish what routes to certification may exist. Some of those may be as basic as having a country create its own certification process, which may have facets related to accreditation of their quality of their programs, as well as building the infrastructure for what the health system needs in terms of certifications, and to the point of developing a certification exam that would be core and central to a unique and specific country. On the other hand, there may be some desire and need to link to existing certifications. And that is where the current work of the Global Health Workforce Council is in terms of making recommendations. And it really is completely to the discretion of those current and existing certifying bodies, how those certifications can or may not be used to achieve certifications. When this grant was awarded, it was around the concept of developing and training an HIM and health information and communication technology, as well as a health informatics workforce globally. We had 5 specific countries that were targeted in the early development: Brazil, India, Qatar, Saudi Arabia, United Arab Emirates, and As part of those target countries, we also then added representatives from the 6 World Health Organization regions. This reflects the composition of the Global Health Workforce Council, and this is incredibly important because what it demonstrates is the fact that the resulting curriculum is not a U.S.-centric curriculum. It is a very multicultural, multinational document that reflects the views of the participants of the Global Health Workforce Council, and more importantly, the much broader community of individuals that are helping to support the work of the GHWC through ongoing work groups. So to give you an example of how this process evolved and how the curriculum itself was developed, we need to reflect back on this being an iterative process, whereupon an initial set of academic competencies were released. Those competencies stemmed from many existing sources. Certainly we pulled from in health information management, Australia, the U.S., and Canada, because they have long-standing programs. In the health informatics realm, we looked at what's happening with AMIA and IMEA in terms of competencies. We also looked at competencies from different HICT kinds of roles related to work that had been done by the European Union and the United States. So we had a great starting point, but we had to do some level setting because each of these groups that have been working on different kinds of curriculum-related matters had done so in a little bit of a different way. The council pulled together those competencies, determined how to structure them so that they were all very similar, added some of the features that you'll see later when we go through the curriculum. Then we released that first set of competencies to a public comment period. Not only was it shared through the Hema Global website, it was also sent directly to countries that we knew had asked about health information professionals and how to develop an infrastructure. We had a significant set of comments that came in. Then we looked at each of those comments, revised them as appropriate, reissued the document, went through another set of comments until we got to a point of a fairly standard consensus-based approach where the final document resulting reflects the input from many sources. One other thing I'd like to point out about the GHWC and its work is that, as I mentioned when we first started, we currently do have work still going on to the advancement of this project. We did the initial set of competencies related to academia. We've been working on currently during phase 2 some role mapping that helps us to link each of the domains and competencies to jobs that are available and in use in countries across the globe today. We also are in phase 2 developing a maturity model, which is a way to help a country determine where do they fall in the big scheme of the health information profession need today. And then finally, the third project that's being undertaken as part of phase 2 is related to that certification guidance. And the further that project team has gone forward, that document is really being referred to as how to develop an infrastructure for the management of health information, because that takes into consideration all of these things that we've talked about, the maturity model, the fact that there are certain jobs that are needed to be filled, and how ready is a country as a whole for the health information perspective, but also from the academic communities. So at its baseline, before we get into the actual curriculum competencies that I've talked repeatedly about already, I want to set the stage a bit for why these competencies were done in the way that they were. So over time, for the countries that have already had a strong infrastructure around health information management, health informatics, and even more broadly in all kinds of positions, even outside of healthcare, There sometimes has been the perspective that there's a gap between what happens in education and what's needed on the job. And that's a problem, of course, because many people go to school not just for the learning that they get from that, but more importantly, because they also are being prepared for a job. So if there is a gap between those two things, which is what a Lumina study has suggested, essentially that study says that 96% of the academicians believe that their academic offerings produce students with market-ready skills, and only 11% of the employers agree. That's a pretty big gap. Then we have comments that we've seen from students that have done a great job in school. They've followed all the rules, they've gone to their schools, they've taken their internships and professional practice experiences, and then they're looking for a job, but they can't get the job because they don't have experience. It's that ugly chicken and egg cycle that we always hear about. How do you get experience if you don't have a job? But at the same time, coding is really, although it may be considered in many cases to be entry level, it requires a foundational set of academic preparation, and then it requires continual practice. In addition, other supporting concepts, Hema followed up on that Lumina study to get a better understanding of what the perception was within HIM specifically of that disconnect was. Hema did a stratified random sample of 180 individuals in the HIM profession with 100 responses, both from the business sector as well as the educator sampling population as well. They asked questions about how prepared students were in regard to professional and technical leadership. They asked about the importance of apprenticeship and other programs and federal support of those programs. The results that we see here are more encouraging from the HIM community because it reflects the fact that educators and industry alike are in agreement that there is a disconnect, and that disconnect really is oftentimes as a result of advancing technology, the fact that continuously and often we have changes that are occurring in the workforce, and if the academic community is not aware of those changes and if they don't have access to those same technical resources, then they can't produce students, for example, that know how to use those systems. So we know that we have greater work to do in our country about making that connection, and we've got lots of things that we're doing to help improve that process. But some of the other comments that you see on this slide also help to give you a sense of where we stand today. Finally, the last set of results that we thought were important to share here to give you a sense of the overall flavor of helping to understand why competency-based education may be the best way to address this issue is because we're looking at the responses that seem to suggest that these professional practice experiences, apprenticeships, 42.7% of our respondents said that that is something that they feel that would help to reduce the disconnect. We know that we have communication between educators and employers that's needed. That's just another word of advice to countries that are considering adopting a curriculum to develop an infrastructure. Part of that process should be, how do we get that relationship between educators and employers to ensure that we're meeting the need? As we said earlier, we really represent in this curriculum the three disciplines of health information management, health informatics, and health information and communications technology. On this slide, we see various definitions, HIM focusing on the acquisition, analysis, protection of health information that's necessary for improving healthcare quality, safety, privacy, and efficiency. Informatics with its clinical focus and clinicians in using the information systems and technology and applying that to the continuum of the healthcare delivery. So it's a very interdisciplinary field. And then certainly we can't do any of that work without having the underlying technology. And there is a whole set of skills and requirements around how to develop and manage the technology pieces that focus on the management of health information and systems by working with hardware and software to manage and store patient data. Very infrastructure related to technology, a lot of tools, development and managing secure health information. So these are all critical pieces that are part of the big picture that we see on the screen, with the final piece being the concept of information governance. Information governance focuses on information as a strategic asset that requires high-level oversight, and it really speaks to the fact that as technology has advanced and continues to advance, that there are many, many dangling threads. You know, we have multiple systems collecting similar information and trying to exchange it with other systems that the structure of the data that's being exchanged is completely different, or it's named differently. So how do you get to that point of ensuring that you have data integrity with information exchange between systems, between states, between countries? How do you get to the point of ensuring that the information is protected, that we start to look at the whole life cycle of information from the point that it's originally captured, how it's retained, and how is it finally disposed of? All of this feeds into the commonly known theoretical model of data, information, knowledge, and wisdom. Data alone, if we think about data fields, there's a whole set of language around the concept of data governance. And that's different than the concept of information governance. Data governance being more granular and looking at the actual data that's being collected. Information governance looking at the entire program and using the kinds of principles that you see on this slide. You'll see much about information governance actually interwoven throughout the curriculum itself. Because this is a massive body of knowledge that we're dealing with, because we're talking about 3 different professional disciplines, and each of those disciplines having areas of overlap, we have 29 foundational domains or high-level topic areas that are addressed throughout the curriculum. Here's a slide that gives you just an overview of what one piece of the curriculum looks like, and then we will look at some of those features in more detail in the rest of our slides. So we certainly see that we have the domain number along with the title of the domain, and then the definition of the domain, a very broad definition. So for every one of the 29, you'll see the domain number, the title, its definition. Then we see the labeling for the rest of the fields, and these first few areas where we have the foundational level, this is really important because as we went through that iterative process of developing the curriculum, there was an awareness that no matter whether you were working in health information management, HICT or HI, that there is a set of core foundational content that everyone should know at all academic levels. So as I noted earlier, we do have 3 academic levels. We have an entry level, a mid-level, and then an advanced level. Each of those 3 levels is going to dictate how a school packages these curriculum competencies to lead to diplomas, degrees, or advanced degrees, for example, like a graduate degree of some type. But the foundational content is included in all of those things because everybody practicing in the space of any of the health information professions needs to know these things. The Bloom's taxonomic level that you see in the middle relates to the competency. So the column that's labeled competency is the learning outcome. That's what the students should be able to do when they've completed their program. So we see the Bloom's level associated with each of these competencies. At this point, the important thing to note is that the Bloom's level, which is a very standard measure used throughout educational systems throughout the globe. The Bloom's level dictates the verb that's used in the competency statement. And as you know, there are varying levels of the Bloom's taxonomic scale. So we can, in some cases, be seeking understanding, where in other cases we might want a much higher learning outcome, such as an evaluation, an assessment, or a synthesis. And so there are various terms that we use, but the important point here is to know that you're measuring the learning outcome. You're not measuring the curricular considerations. The curricular considerations appear on the right of the screen, and those are simply the topics and the thoughts and the items that you may want to consider as you teach the competencies so that students can get to the required competency level. And this is important because the curricular considerations allow for a degree of flexibility. We have a global curriculum that may be used in multiple countries, and if that's the case, how can we bring in the unique characteristics that are specific to an individual country? If, for example, 3 different countries are using this curriculum and they all have different reimbursement models, they're going to want to talk about what's the reimbursement model used in their country, because that's what's going to be important. These curricular considerations are examples and recommendations, and they are not cast in stone. So it is this area that will allow for that flexibility. You still have to achieve the learning outcome, but it's really based on what is specific and unique in your country, as well as some of these other things that are provided as examples for you. And then finally, before we go to the next slide, I wanted to point out this particular screen print happens to be from the advanced level. Typically, the advanced level would be something that you might relate to a graduate degree, such as a master's degree. So a lot of times you're going to find higher level Bloom's levels in that particular section. We could have taken a screen print of the intermediate, and what that might mean is that instead of teaching in a graduate program, you might be teaching that content in a baccalaureate program, if that's what you call that level in your country. So again, each country has its own variants. Some countries use the word diploma, some use the word associate degree, and you have to take those things into consideration as you implement this curriculum. So just a little bit more detail, and I wanted you to have this visual before we got to this detail. The fact that the modules include all 3 sections we certainly talked about. Whoever is using this curriculum in terms of implementing it within an academic institution should make those decisions based on what's appropriate in that particular school. The domains, the fact that we have those 29 standardized domains that represent primary concepts. The competencies in general, we've talked about those to a great degree, that they vary by domain and by academic level. And one point that's important to make that I didn't make earlier is that the competencies are not cumulative when transitioning between academic levels. So simply stated, that means that if you wish to offer or have a student that wants to have a graduate degree in health informatics, but they have a undergraduate degree in something entirely different, they should be able to get to that higher level informatics degree. And partly that's supported because of that foundational concept, and partly because it's supported because as you design your academic programs based on these curriculum competencies, that you will design it such that they get the information needed as part of that program. We talked a lot about the foundational competencies, so I won't repeat that here. We've talked about the academic levels and the need for each country to determine what's appropriate within their country and within the institution. And I'm going to clarify why I'm saying both country and institution here, because these 2 things really go together. It doesn't make sense for schools to implement a curriculum if there has been no support of the need for that type of education leading to jobs within the country. So part of that broader assessment that we talked about, that part of that understanding what makes sense in this country has to be based on your knowledge of that country and actually your influence of that country. If you don't have an infrastructure, but you're aware because you work with this kind of information about how valuable that is to helping to improve population health and to improve the situation of healthcare, then you, along with an association within your country, may wish to exert influence through your ministries of health, your ministries of education to make that happen. A HEMA's career map is a good way to visualize the possibility of the kinds of jobs that may exist just in the health information management field alone. Even as we expand that thinking to broadly more encompass health informatics and HICT, there are many different roles that exist. At this point, I believe we have reached nearly the end of our presentation. I did want to share with you this references slide that gives you some additional detail about some of the comments that we made here today. With that, thank you again and good day.